Hey folks, Blair from Nose Creek Sport Physiotherapy, where we get you moving faster and feeling better. Well, today's topic is osteoporosis. Quite often, a lot of my middle-aged patients will ask me and say, hey Blair, my mom's got osteoporosis. Is it safe for her to come and get some treatment with you? And the answer to that is yes. So what exactly is osteoporosis? Well, osteoporosis is a very common condition, and what it is the loss of bone density as we age. So it's really important to keep our bones healthy, because the less density we have in our bones, the higher risk we are for fracture. And some of the fractures we typically see are like compression fractures, where the spine gets compressed down, and that's why a lot of those osteoporotic patients are very bent forward and kyphotic. So there's about 5 big risk factors that we want to look at for osteoporosis. So the big one is age. So our bone mass tends to stop increasing after the early 20s, and we're basically fighting a loss, or we're fighting to maintain our bone mass as we age. Therefore, the older you get, the higher risk you are at developing osteoporosis. Gender. Women tend to have a higher risk of osteoporosis than men, because generally they have smaller bones, and especially petite women, they're even at more high risk. Family history. So there is a genetic component. So if your mom or dad has osteoporosis, there's a good chance that you probably will. Lifestyle. So making sure that you're getting weight-bearing exercises in on a daily basis to stimulate bones to keep them strong is very, very important. And menopause. So early menopause and missed periods due to eating disorders sometimes can cause definitely a risk, increased risk for osteoporosis. Since physiotherapy is very gentle and very specific, it's very safe for your mom or dad to come in and get some treatment on that. And basically what we provide is we do gentle mobilizations to get the joints moving. We provide them with a strengthening and a stretching program to basically prevent the further progression, if it's their spine, for example, of an increased kyphosis in their back as they age, which will lead to chronic upper back and neck pain. So the best prevention, though, really is, and the research points to this, is that our bone mass for our life is basically set between age 10 and 14. So if you have kids, that's the big take-home tip today, is like get those kids active between ages 10 and 14. Make sure they're playing soccer, they're running around lots, doing lots of activities throughout those 4 years, because that's when you set up the biggest potential for bone health for the rest of their life, and again, reduce their chance of a fracture later on in life. So the top 4 things that you must do as an adult now to basically maintain bone health. Number 1 is make sure you're getting enough calcium and vitamin D on a daily basis. Well, calcium and vitamin D you often find in foods. Taking a supplement can often be necessary. So you need 1,200 milligrams of calcium and 800 international units of vitamin D each day. And I think in Canada we're very deficient on vitamin D just because we don't get the sun like other countries do as well. Next one is weight-bearing exercise. It's very important to maintain your bone mass by doing weight bearing. The more you weight bear through the joints, the stronger your bones are going to stay and prevent them from getting soft. So a simple exercise can be walking with hanging on to dumbbells, 5-pound dumbbells, and sort of swinging your arms and doing bicep curls and things like that. Number 3 is you really want to avoid alcohol and smoking, because that will definitely speed up the bone loss as well. And then, the other thing is to get your bone density tested. So, women over 65 should definitely be getting their bone density tested. And then women under 65 that are at high risk, that have those 5 risk factors that we talked about, it would probably be a good idea as well to get their bone density done. So you can talk to your family doctor about that. Well, folks, I hope that helps you in regards to osteoporosis, what it is, and whether treatment is safe. So again, my name is Blair Schachterly on behalf of Nose Creek Sport Physiotherapy, where we get you moving faster and feeling better. Take care, folks. Till next time. Bye-bye.